Hello, everyone, and welcome back to I'm a Talk About It. My name is Alicia. My pronouns are she, her, and I'm an accountability empowerment coach and ancestral healer. Today, we have guest speaker Dr. Maisha Correa, my very own sister. She is a board certified psychiatrist. She received her bachelor's in psychology from Vassar College, her MD from UCSF School of Medicine, and did her residency at University of Washington School of Medicine, Department of Psychiatry and Behavioral Sciences. Woo. Today's episode is called Breaking Barriers, Let's Talk Mental Health. So thank you everyone for showing up today. I'm super excited for you all. I hope you find some great advice in this talk. So today we're going to discuss mental health within the Brown and Black communities and why it's important to tend to the self. There are many benefits to seeking support from a mental health professional, but how do we navigate what may be an unfamiliar territory as Brown and Black folk? So we're going to talk about that today. So welcome, Maisha, my sister. How are you? How are you doing?
I'm doing great. Thank you. Happy to be here.
Woo! All right, so let's just jump right in. Well, first, I want to start with asking you, what is the difference between a therapist and a psychiatrist? Some people may be completely new to mental health, so any advice that you can give on those two would be really great for everyone.
So this comes up actually a lot in my clinic because people show up and then don't realize that there is a difference. And so happy to explain this. A psychiatrist is someone who has gone through biomedical training, has their MD, like I do, or their DO, which is another kind of physician doctorate degree, that then goes on to have specific training in mental health in a psychiatry residency for another 4 to 6 years, depending on what they subspecialize in. Psychiatrists can provide psychotherapy because of the way that the mental health and healthcare industry functions right now. A lot of psychiatrists do not provide psychotherapy. And instead, we focus more on managing medications and in administering psychiatry interventions like electroconvulsive therapy or ECT, transcranial magnetic stimulation or TMS, or kind of newfangled treatments for treatment-resistant depression, like ketamine infusion. And a therapist, on the other hand, can be a professional from a number of different trainings, including psychology, licensed clinical social workers, licensed professional counselors, marriage and family therapists, and I'm sure I'm missing some there. But essentially, their training focuses on administering talk therapy. So talking with somebody, explaining how you feel, processing difficult emotions, figuring out what tools and coping strategies make sense for you, being able to practice them, and then come back and tell your therapist how it went so that you can kind of achieve more of the goals that you have for yourself and get a little bit out of your own way.
Okay. Thank you so much for explaining the difference. I feel like that question comes up a lot. And I know even for myself, when I was looking into finding support in my own life, I had some trouble figuring out what the difference actually was. So that is very helpful. Thank you so much. Mm-hmm. And then let's talk about how you got into psychiatry. What made you want to become a psychiatrist?
So I was a weird kid, as you know, and
we're both weird, so it's okay.
Very interested in like the inner workings of the mind from a very young age. And when I realized that there was a job where, so to rewind a little bit, very interested in the inner workings of the mind, and also very, very talkative. And this is a bad framing of this behavior, but I was told that I was nosy and a busybody. All of those things actually make a very good psychiatrist. So when I discovered that was like that being a therapist was a job, I was like, oh my gosh, that would be perfect for me. Like, I just talk with people about their day. I listen and I'm supportive, and like I help them figure out tough situations, which is what I was doing with my friends anyways. Like I was like the friend group that everybody came to. And so there was that interest. And then I also really enjoyed biology and chemistry and all the hard sciences and math and statistics. And so when I then later realized that there was a field of medicine where kind of mental health care was part of the job, it was kind of a set deal for me. And that was at about age 16 when I decided that I wanted to be a psychiatrist, which is weird. Like most people aren't that specific, but I was.
You just knew what you wanted to do and you knew what you were good at, which is cool to figure out when you're 16. I'm pretty sure that when I was 16, I got a ruby red guitar from Walmart and changed my name to Jane and then thought I was going to be a rock star.
I believe it was Bazooka Jane.
Yeah, Bazooka Jane. I dyed my hair black and cut some bangs that were horribly done. And yeah, wow, that's so cool that you were able to figure that out when you were 16.
Yeah.
So, oh, go for it. Anything?
No, go for it. That's all right.
Okay. So what was it like for you to navigate the field of psychiatry, knowing the racial makeup of the field? And if you can kind of talk about that a little bit.
Yeah. So the racial and gender makeup of medicine has changed a lot since I became interested in psychiatry and compared to now. So like if you look at physicians that are age 65 and older, 82% are male.
Wow.
Right? So it's like shocking. But then if you look at I think it was in 2019, the graduating medical students in the US, it was the first, 2019 was the first year where it was predominantly female. So it was 50.5% female in 2019. And that was the first time that had ever happened. Mm-hmm. And so there is a male predominance, but that's changing. In terms of race, it's about 5% of physicians are Black.
Wow.
And about half of that, 2.6%, are women. So there's a little less than 25,000 Black lady doctors out there.
Oh my gosh.
Black lady physicians out there. There are many more Black lady doctors. So it's diminishingly small. It's like, so it's such a small percentage. And it's growing, but there are going to be some growing pains as this new batch of graduating medical students that are kind of pushing the diversity boundaries or expectations. They're moving into a field where there's not a diverse leadership. They're often kind of the first or only person of color in their program, in their specialty, at their hospital, which was something that I experienced as well, kind of moving through medical school, through residency, and now at the job that I'm at now. So that kind of first and only syndrome is really, really common in medicine for people of color.
Wow. I didn't realize that the percentages were so low for Black women doctors in psychiatry. Like I knew
that's not specific to psychiatry. That's just physicians at large.
Wow.
So just of all physicians in the country, 25,000 or so are Black women. That's it.
Wow. That blows my mind to think about. And it's like, as I go through to look for mental health support, it's no wonder it's quite difficult to find someone within that field that may look like me, but that makes sense now. And that's why it can be difficult.
And it makes sense that there would be trouble with representation in medicine, because one of the biggest factors that determines whether somebody kind of statistically is going to go into medicine is whether they have a family member that's in medicine.
Yeah.
And there was a concerted effort to keep Black people out of medicine, like, which is where kind of around the time that HBCUs were developed. The same sort, there were Black medical colleges that were around that then got kind of blacklisted. So, and so there were all these places where Black people were able to go to medical school and get a degree, but then they weren't accredited. I think it was accreditation, like they weren't allowed to be accredited. And so then they were kind of left in the same place that they were before those institutions were developed, where they were not granted admission to the predominantly white institutions, and they were able to kind of keep people out. So there's this long legacy of keeping people of color out of medicine. And it's only recently that we're starting to see this shift that I talked about earlier, where things are kind of more reflective of the population at whole.
So what was it like for you going through your training and your residencies as a Black woman in these primarily male, like white male dominated spaces?
So I think that I ran up against what I mentioned earlier, in that like my medical school class was fairly diverse, but then you look at the faculty and it wasn't terribly diverse. So when we got into situations where kind of somebody with experience handling racially charged situations would be necessary, there wasn't anybody like that. And so, like, for instance, unfortunately, one of my favorite courses in medical school was this twice weekly group called Foundations of Patient Care, where we would essentially learn how to be a doctor, like learn how to be a person and treat our patients like people and talk to them and gather a history and be empathetic. And we would meet within small groups of, I think our group was like 6, and we had 2 facilitators, a psychologist and an internal medicine doc. And we would kind of discuss being a doctor and kind of go over different cases. And then the school would also hire standardized patients or actresses and actors to play patients. And then we could go through gathering a history. Like, one of us would be selected, and then we gather the history in front of the rest of the group and in front of the facilitators, and everybody would have the opportunity to like pause and give feedback, or pause and ask a question. The person doing the interview might ask for guidance, like, I'm feeling a little bit stuck here, what should I do? And so it was this really, really rich exercise in learning how to conduct that relationship and build rapport. And the last case that we did was supposed to be this like homeless teen. And we had heard from the class above us that this case was supposed to be the most difficult. The character's name was Rage. And Rage was just like real difficult and was kind of hostile. And because it was the last one, there were 2 of us that still had one more kind of case to do. And so I partnered up with someone else to do it. And she and I talked beforehand and said, okay, we'll introduce ourselves. You'll do this part, I'll do this part, and then we'll kind of summarize together. And I was like, yeah, that sounds great. We introduce ourselves. Again, we're in front of a big group, not a big group. We're in front of a group of our classmates and some faculty facilitators. We introduce ourselves. I'm supposed to do the first part. So I did my little introduction, like, oh, what brought you into the clinic today? How can we help? She like looked straight through me, the actress. And I was like, weird. Okay. And so I was like, not sure if you heard me. So I'm student Dr. Korea. Like, we're here I understand that you're here for X condition. Is there anything that you want to make sure that we know? And she did not respond. And eventually she turned to the student sitting next to me, who happened to be a white woman, and was like, I need to talk to a doctor who's not a nigger.
Oh,
yeah. And I was shocked and didn't say anything. Was just like, clearly, like, my face was shocked. I didn't know what to do. Nobody paused the session. The facilitators did nothing.
Wow.
The other student that was with me was like, well, student Dr. Korea is very capable. And so you can definitely talk to her. And she's like, absolutely fucking not. And then, yeah. And so then now I'm like steaming. And I knew after a couple of minutes that I was either going to jump across the desk at her or I was going to start crying. Neither were acceptable. And so I walked out, and then they paused the encounter. And then they went after me. And it was just like failure from like dealing with that incident was just failure after failure after failure by leadership to the point where like nobody stopped the interaction. Nobody scolded the actress. Then I was pulled into a room with her by administration and encouraged to hear her out. And I was like, I don't need to hear anything. Well, she really wants to apologize. Well, her apology would be for her own absolution. I don't want to give her that. So she could just carry that with her the rest of her life. I want her to think about that every time she thinks about saying that word, that she never got absolution. This is intentional. And I refused to sit with her and I left. And then the next week I went back to that same small group and they were like, we need to debrief, blah, 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 blah. Maisha, how are you doing? And I was just like, I'm really upset that nobody said anything on my behalf except for so-and-so. I'm not going to say the student's name. And I'm irritated that they tried to make me let her apologize. And they were like, well, speaking of which, we have a letter from her that we wanted to read to the class. And I was just like, I don't want her to be able to apologize. And I left again when they read the letter because I was like, God, like I asked for one thing.
Yeah.
Like it was just mismanaged from start to finish. And like that kind of stuff wouldn't happen if somebody in the driver's seat either was a person of color or had any sort of training on handling things like that.
Right.
So,
right. Wow.
yeah.
I don't even know what to say. I applaud you for being so consistent with your response and your boundaries, because I cannot say that I would have done the same. And I'm thinking about this new wave of doctors and what they might face. And do you think there's going to be a better future for them? Like, of course, they're going to be the one and onlys or the first and onlys in their fields and their residencies, wherever they might be working. Do you think that because diversity is a little bit more of a priority, it might get better for them?
I think so, but I think that it's sometimes the blind leading the blind. Like people can have a value placed in diversity, but not really understand inclusion and what that takes.
Mm-hmm.
And so they'll bring people of color in, but then not give them a seat at the table. Mm-hmm. Or continue with policies that discriminate against them and refuse to acknowledge the ways in which they're marginalized, even within the workplace that they're in, like the things that are within their control, refuse to acknowledge those things. And so I think that class of 2019 is probably going to have better luck than I did, but it's not going to be as good as the luck of the class of 2030. Like they're going to have it a little bit better because then like the people my age and 10 years younger are going to be now not just attendings, but like directors of the department and chiefs of the service and things like that at a greater, at like a critical mass where they can start to kind of make changes.
Right. That makes a lot of sense. And it comes up a lot. Being in the field that I was, at least for my full-time job, being a part of diversity, equity, and inclusion departments where well, at least I'm the person there trying to bridge communications and create safer spaces. So as they hire more people of color, we have things set up within the company to support them, to make sure they're thriving. because there is very much so a very old way of thinking at most companies and most corporations. Mm-hmm. I would also love to think that down the road it can be improved. It's just a very interesting time right now with everything shifting, even with the pandemic and awareness on inclusion and diversity and equity in general. So thank you for sharing your thoughts. I appreciate that, and having just so much transparency around what you experienced. So I want to shift the conversation a little bit and talk about mental health within Brown and Black communities. If you can talk a little bit about barriers that the community might face, or stigmas, misconceptions. So I kind of want to bring awareness to why it's a little bit more difficult for Brown and Black communities to access healthcare, and what is really going on.
Yeah, thank you for that question. I think it's an important one. So for accessing mental health care, even outside of kind of not even thinking about race, accessing mental health care is a disaster on a national level. There are all of these barriers to just getting into any kind of care, not even to mention quality care. And within medicine, there's this long, long legacy of racism and of treating Black and Brown people like they are less human in a physical sense and in an emotional sense. Like, I can't remember the numbers exactly, but a shocking percentage of practicing doctors at this, I can't remember the date. It's like jumping right out of my brain. But there was a survey that looked at whether physicians, residents, and medical students thought that Black patients felt less pain. And a shocking percentage of each of those groups thought that Black people felt less pain. A shocking percentage of each of those groups thought that Black people felt less pain because they literally had thicker skin.
That is so bizarre.
Isn't it bizarre? It was like recent. It was within the last 20 years. I remember reading that and just being like, what the hell? Is like people who are people's doctors. Somebody has an appointment with that doctor tomorrow. Like, it just blew my mind. And like, what hope is there to unteach that if everybody straight up the line thinks it? Like, there's no, so things like that. So their medicine in general treats Black and Brown patient, whether it wants to admit it or not, treats Black or Brown patients differently than white patients. When they're seeking pain management, like the thicker skin thing comes in to play. Black people are more likely to be diagnosed with a chronic psychotic illness inappropriately. They're more likely to be diagnosed with something like bipolar disorder, again, inappropriately. And when they're diagnosed with severe conditions like that, they're more likely to inappropriately receive involuntary treatment.
Wow.
Treatment that comes with a lot of side effects and long-term complications. They're often traumatized because they're getting involuntary treatment inappropriately, which scares people away from mental health care, right? Mm-hmm. And so, and a lot of that misdiagnosis, or part of that misdiagnosis, comes from kind of cultural incompetency, like just not understanding colloquialisms, idioms, like differences in how we express things. Like, yeah. So like, if you don't understand AAVE, somebody might say something to you and it sounds psychotic, if that's what you're looking for. And so people end up getting these like inappropriate diagnoses and all of the like the treatment and rigmarole that comes along with it. And in the face of that, we also have this history of things like the Tuskegee experiments, where the medical institution knowingly allowed people to like have neurosyphilis, like to have their syphilis progress to neurosyphilis and not intervene when they knew damn well that they had a treatment for it. And they felt comfortable doing that because Black people were essentially less than human and didn't deserve to have informed consent about their treatment. And like people know about the Tuskegee experiment. They know kind of through personal experience and from talking with their friends and family that Black people get treated poorly. And as a result, they don't go and seek treatment, and even when it's needed and when it would be helpful. And so there are some justifiable reluctance to access care. Mm-hmm. And there's also a lack of a concerted effort from medicine to extend an olive branch and to admit their faults and to mea culpa this whole thing. And I think that within Black physicians and Black physicians in mental health, I know that there is a concerted effort coming from Black physicians, but like I said, there's so few of us that it's not quite permeated the population yet. Right. And it's a hard fight because like once we're part of the medical institution, we're suspect anyways.
Right. Oh. So knowing that the quality of treatment can vary depending on the caregiver's background, like what advice would you give to people of color who are looking for quality care? Like what should they look for? What advice do you have to share with them?
Yeah, I think that one thing that was helpful for me to kind of encapsulate this idea was a study that looked at the perception of quality care and outcomes. So not just how the patient felt about their care, but also how well they did afterwards. Mm-hmm. And looking at the care that was received by white patients, by patients of color, and comparing that treatment that they received based on whether their physician was white and race matched, a person of color and race matched, a person of color and like race mismatched with a different person of color, and seeing kind of how does that stratify out. And what we see is that white patients across the board get good care. We see that patients of ethnic minorities get less good care compared to white patients, and that their care, how good of care they get, depends on whether the physician that they're working with is matched based on race. And so if like an Asian patient would get less good care overall from a white doctor than a white patient would, that same Asian patient would get, if we looked at that same Asian patient and they had an Asian doctor or a Black doctor, they would get better care from the Asian doctor. And same thing with like a Black patient. So if we just look at the numbers, if you're able to find and kind of the idea behind that is that there's not an issue, there's less of an issue with cultural competency getting in the way of delivering care if you come from the same culture as the person that you're talking to, with one caveat that white is the default. And so everybody is very well versed in white culture. And so we all know how to treat white people with respect, because if we didn't, we'd be in trouble. But that's not necessarily true for other races. So if we just look at the numbers, if you're able to find somebody that comes from the same community as you, you're better off. You're more likely to have a doctor that's willing to discuss kind of non-Western interventions, someone that's willing to involve you in the decision-making process, someone that's willing to kind of accept your feedback on things that have gone awry in the relationship. There's all these other different things that they looked at in terms of the interaction that are just better if you don't have to also translate cultures in order to get it done.
So if someone is like completely new to seeking help, is there like a website they can go to, or how do you suggest they go about searching for mental health support?
Absolutely. So there's a website called therapyforblackgirls, all one word.com. And it's a resource. It's kind of a mental health resource hub for that. It's where the information is targeted towards and culturally kind of framed for Black women. And I believe there's also a directory of Black therapists on that website. There is also blackmentalhealth.com, which is a directory of Black psychiatrists. And so if you're somebody that has been on medications before or that is interested in talking about medications, that's a good place to start. If you're more interested in kind of processing how you're feeling, building up skill sets, or just kind of getting your feet wet with mental health, going to the therapyforblackgirls.com would be a good place to start. If there's nobody in your, like, so like I live in El Dorado County. I am the only Black therapist in the county, so I can't see me. So if you're in a place like mine where there aren't any Black therapists around, where I tell all of my patients to go is psychologytoday.com. You can go on that website and put in your zip code, you can put in your insurance, and you can select the type of therapy. Like if you're savvy about therapy and you've tried different therapy before and it's been helpful and you want to try that therapy again, you can select that therapy and get a kind of filter a list so that you get the people that meet your criteria. You can, it's as granular as being able to say, I want a woman who is Jewish and is over 35. Like you can do that and find somebody that really kind of fits your demographics.
Wow. Cool. Well, thank you so much for sharing those resources. I'm sure everyone's going to be very appreciative. Even myself, I will be all up on those websites after this. So just looking forward to future generations, because the work we do today will affect what happens in the world tomorrow and kind of ripple out. So what do you have to say to the listeners? Like, do you have any parting advice or comments that you would like to share?
So to anybody, any young people of color, especially Black people that are thinking about going into a mental health field, if you have not already gotten your undergraduate degree, or if you have, consider an HBCU. Because all of the like cluelessness of the administrations in the PWIs with regard to like managing the racism of medicine is not present at the HBCUs. Like from day one, they're acknowledging that that is the case, and they're working from a point of race of medicine is racist, and this is how we be Black doctors within a racist system. And so like if you're considering a field in medicine or in any other mental health field, think about going to an HBCU to get your training, because you'll have the tools that you'll need in order to combat racism within your field. To those that are maybe overwhelmed by the process of getting a therapist, start by going outside every day and get lots and lots of sunlight. Be a little solar panel and take in all that energy. It will help you sleep at night. And if you don't sleep, it's hard for anything to go right. Try every day to be physically active, socially engaged, and mentally stimulated. And you get bonus points if you're able to find an activity that does all three. So go take a dance class that does all three. And if you ever or not if you ever, but if you're a person that wakes up every morning exhausted as if you hadn't slept, especially if you are a snorer, go talk to your primary care doc about your risk for obstructive sleep apnea, because it goes way underdiagnosed and it will have catastrophic effects to your mental health if you don't treat it.
All right.
Yeah.
Well, thank you so much. This has been such an amazing discussion. I hope that everyone found some value in this. I love talking about mental health, just like you. I was a weird child and I love to think about the mind and how to support people. So thank you. This has been amazing. I just want to remind everybody that for Flourish Ashe, I do offer one-on-one coaching. The newest one is called Highest Knowing, and it's about breaking generational cycles and finding your freedom. I have a live webinar coming on May 10th on accountability and finances. So we'll talk about your relationship with money, promotions, navigating corporate life, and seeking financial stability, and then how to identify common corporate traps or red flags around financials, which also kind of ties back to what we were talking about with DEI and being within a corporate setting. And then on the 17th, I'll have another Journey to Self workshop for claiming accountability. Again, early pricing ends on Wednesday, 5/11. And then if you're interested in joining us for the third episode of I'm a Talk About It, you can join me with Elva Viegas. She'll be discussing with me intersectionality of cultural beliefs and navigating relationships. So join us next month for another episode. And then don't forget, if you haven't already, if you want to stay in the know for all of the latest things Flourish Ashe, which includes podcast updates, astrology advice, yoga, and coaching, be sure to subscribe to my email list. The link is in the bio on my Instagram, and I will put it in the description of this episode as well. So thank you all again so much. Again, a huge thank you to you, Dr. Maisha Korea / my lovely sister. I appreciate you showing up and sharing your lovely thoughts and advice. Again, I hope you found value and looking forward to sharing the rest of the episode with you. And that is a wrap for today's episode. I'm going to talk about it. Thank you.